What to do if you freeze in an emergency situation. These are my tips from a PICU nurse of 10 years. So historically, I have geared this series towards new nurses, and this is still very much applicable, but this also applies to anyone. Really, there is no difference in the neurobiological processes of seeing a patient in an emergency situation that you're responsible for reacting in, and being in your car in the middle of the highway and all of a sudden you lose power of your car. We hear about the fight or flight response all the time. But really, there's another response that can happen in the sympathetic nervous system. So it's really fight, flight, or freeze. This freeze response is exactly what it sounds like, where you sense a threat, but you're just unable to move or react or engage your rational thought. And this is a very normal reaction to a threatening situation in an acute stress response. However, it doesn't really serve you well in an emergency situation where you have to react to a patient or when you're in the middle of the highway and your car gives out. So first, if you can foresee a situation, obviously you should do that. So if you're a nurse, for example, and you have a patient, then the first thing that you should do, or one of the first things that you should do when you go in on your shift is, what is my patient's diagnosis? What is the worst thing that could happen to this patient? How am I going to know that that's happening? And what am I going to do? We all know that it's not possible to always foresee situations beyond our control. So these are the steps to work yourself out of a freeze if this happens to you. The first thing that you're gonna do sounds silly, but it's take a couple of deep breaths. And no, this isn't necessarily going to resolve the situation, but it helps engage yourself and to ground yourself. And that's your next step, to really try to ground yourself to the environment. So that means engaging your senses. Keep in mind, this is happening all in a matter of like milliseconds. So yes, you need to respond with something meaningful, but in the meantime, you need to regain control of your rational thought. So in engaging our senses, you're going to focus on the surroundings of your environment. What does it smell like? What does it feel like? What does it look like? What do you hear? Engage. In grounding yourself, you're also trying to prevent yourself from going down the rabbit hole. So basically, you don't have time to sit there and think about, oh my God, what if this patient dies? I'm gonna get fired. The family's gonna hate me. I'm gonna lose my job. I've worked so hard. What am I gonna do for a living? It's so easy to fall down that rabbit hole, but you really need to harness your attention towards the present, here and now, and not think about long-term consequences. Try to embrace the physiological changes that are happening in your body. Your heart is racing, your palms are sweating, you're shaking. Instead of using that to make yourself feel like you're crumping, try to reframe that as, my body is preparing myself to engage in this situation. It's go time. Next, you're gonna start small. Just take a step forward. If we're talking about a patient, literally move your foot forward towards the patient's room. This sounds stupid, but these small physical movements will help break you out of that freeze and reframe your focus. You are going to do the simple, small steps that you know how to do. Get help. You know where the code button is, you know where the staff assist is, or how to get help. Focus on doing that. From there, you're gonna hope that you're able to access some of those memories of the training that you know how to do to be able to perform the next steps necessary. If not, then help will arrive and you need to be able to try to communicate the situation as best as you can so they can respond appropriately. So I wanna really emphasize that this freeze response can happen to anyone, and it can happen to a seasoned nurse who simply hasn't encountered a situation before. So try to give yourself grace. If this happens to you and you're unable to kind of recover from that freeze response or act in a way that you feel like you should have as the nurse in a situation, go home that night and try to debrief. This is really important. So whatever happened has happened and you will need to move on from there, but you can learn from it. So what I like to do in these situations is try to remember the situation, but instead of what actually happened, think about what should have happened, and then see yourself going through those steps. Try to really actually visualize it. And the utility in doing this is that Your brain doesn't necessarily know the difference between something that has actually happened and is a memory and something that you have kind of like forced into your memory. They both form neural pathways that you can access in situations of an acute stress response. So the next time that this happens to you, if you've gone over and over and over that situation where you weren't able to react, but you've visualized yourself doing the things that you should have done, this will be something that your brain can then access in the future.